If your doctor is not in network now, that's okay. It doesn't mean you're going to lose your doctor. Doctors are being recruited heavily right now to join the tailored plan, to contract with the LME so that they will be in the network for their tailored plan when it launches. They're adding doctors every day, as well as hospitals and big systems. And they might be adding single doctors or entire practices. Keep that in mind too. There's several ways to get into a contract with a tailored plan. If your doctor is not in network with your LME MCO tailored plan, you can still see your doctor, and your doctor will still be paid by Medicaid for those visits. Doctors will have an extra 90 days to sign up for the tailored plan and still be able to receive the tailored plan rate, which is a little bit higher than the regular Medicaid rate, to entice them to sign up. And then from what we understand, there's, after that 90-day period, there's an additional 121 days after that they will still be able to receive that higher rate and have the opportunity to sign up with the tailored plan. They can sign up with the tailored plan whenever they want to. They could do that a year from now if they choose to. There will be some doctors who choose not to. And if that happens to be your doctor and they never ever sign up with the tailored plan, you can still go to that doctor. They will just receive 90% of the Medicaid rate instead of 100% of the Medicaid rate through the tailored plan. So if they're willing to see you at 90% of the Medicaid rate, you keep right on going and nothing changes, and Medicaid will still pay for your doctor. There have been a lot of questions about people losing their doctors. We think that is calming down quite a bit because so many doctors now have signed up with tailored plans.
So last week, in the same webinar we did last week, actually 2 individuals came back with a question. One person came up with the question, my primary care provider tried to sign up and was rejected, was denied. And somebody else chimed in on the chat and said we had the same experience. We're still looking into this. We're trying to find, there may be a lot of reasons why, technical, who knows, there's a lot of things going on, and that's a more complicated question. My recommendation is to you, stay tuned. We're still looking into this and trying to get some answers. And this has been several conversations so far this week. But we also recommend that you contact the North Carolina Department of Health and Human Services Ombuds Office. The Ombudsman's job is to make sure that those kinds of things are addressed and to facilitate, if there's a doctor out there that wants to sign up, and believe me, particularly for the community of people with this intellectual and developmental disabilities, we want doctors and we need doctors. And oftentimes our doctors aren't part of the big networks that other doctors in the other parts of this, mental health and substance use, they're not part of those big conglomerate networks. Some of them are, but there's definitely some that are not. And definitely our specialists are harder to get connected to that. And so to the degree that if you have somebody who says we signed up and tried to sign up for Medicaid services to take care of our patients and they were rejected, call the Ombuds office. And if you're still having issues, let us know, because we'll follow up on it as well.